Good afternoon. It's good to be with you today. I have had the opportunity to work over the last several days in communicating with all of you our plans that we were contemplating, stricter guidelines for certain counties that are experiencing significantly more transmission in those counties than perhaps in others. Those counties are Attala, Leake, Scott, Jasper, Neshoba, Newton, and Lauderdale counties. We have signed an order in working with Dr. Dobbs and his team that we think will certainly help those individuals in those 7 counties. This particular executive order has several requirements. As examples of some of the most high impact requirements, it requires all businesses to screen employees for sickness. Face coverings should be worn by all employees in businesses where you are not able to socially distance by 6 feet apart from your colleagues. Customers of all retail shops are required to wear face coverings in those counties, and masks are required at outdoor public events like flea markets or live auctions. We have worked very closely with Dr. Dobbs and his team, and as we progress through the rest of this particular press conference, we will be happy to go into more detail. I really believe and I hope that these rules will have an impact, but I also hope that they will serve as a signal to people in these counties. We cannot always see and feel the consequences, but the disease is more active in your county. You need to be even more aware. You need to stay even more sharp. We know that individual action and individual buy-in is more effective than any government order. Please, if you live in those counties, be extra aware of your actions and the risk you face. We have talked about this repeatedly. We believe that the next phase of our fight against COVID-19, and make no mistake, it is a fight. The next phase is to take a surgical approach rather than a sledgehammer to this disease. What we're seeing in certain counties is very different than what we're seeing in those 7. Now, that does not mean that there is no risk to those of you that live in the other 75 counties. We just simply need to pay extra attention to local conditions and respond in that surgical way. In the other 75 counties, I am still urging you to be smart, to stay safe, to recognize that the virus is still in your community. We are going to continue to focus resources on long-term care facilities because we know the devastating impact. We're going to continue to have our shelter-in-place order still in effect for those statewide that are over the age of 65 or that those who have pre-existing conditions. That is the population in our state that is most vulnerable to this terrible, terrible virus. We're going to continue to monitor cases every single day. We're going to continue to make decisions based upon the data, not based upon emotion. So with that, I will ask Dr. Dobbs to give us an update on the virus.
Thank you very much, Governor. A quick update for today. We're reporting 234 new cases today and sadly 22 additional deaths. 7 of those deaths are deaths that happened previously that were identified through death certificates and then validated and added to the list. If we look at where the cases are occurring, we know that they're occurring within specific high incidence counties, and those are going to be specifically in the areas that we just outlined here: Attala, Leake, Scott, Neshoba, Newton, Jasper, and Lauderdale. And if we think about where the action is and where we've been most active in our epidemiology response teams, we break it down into our 9 different teams throughout the state. And in that part of the state, those 7 counties, plus 2 additional ones, we've investigated 2,093 cases. We've done contact investigations and quarantines around that many people. That compares to the Jackson metro area, including surrounding counties, and they've had 1,949. So in those eastern counties, they have a significantly higher burden of disease even than the Jackson metro area, including surrounding counties. So that's something that's very impressive if we think about it. If we look at the testing that's done in the state of Mississippi so far, we are finding additional negatives from smaller private labs. We added an additional 1,600 negatives today that'll be updated soon. And so, although it's not on the website yet, we've documented 97,692 tests. And if we look at the tests that have been done so far, the first 10 days of May, we've done over 26,000 tests in the state of Mississippi. So really a great effort by our partners, and appreciate the hard work that has gone into that. And that's all I have for today, Governor.
As a reminder, we set a testing goal of being able to test at least 2% of our population in the month of May. That was a goal that originally set forth by the White House for every state to be able to do 2%. At the current pace, if we've done almost 30,000 within the first 10 days, if we can just have a slight uptick over the next 20, we may can test over 3% of our population in the month of May alone, which would get us up closer to between 5 and 6% of the total population of Mississippi having been tested by the end of May. Again, we've got more work to do. We're continuing to scale up. We're going to continue to focus our efforts on those individuals in long-term care facilities, et cetera. But I continue to commend Dr. Dobbs and his team leading the testing effort. Mississippi continues to be a leader with respect to testing. We identified that way back in March as a key component. And while the federal government has been exceptionally hands-on in many states, they have really been hands-off in Mississippi, because they see that we understood the importance of it and that we're working to get it done. We've got more work to do. We're not done. We're continuing to innovate. We're continuing to find ways to scale up testing. But I will say that that is an area that has gone well in our state relative to many, many of our friends around the country. At this time, I'm going to turn it over to Director Michelle.
Thank you, Governor. Just a quick update on the PPE shipments that pushed out yesterday. We delivered to 23 Tier 1 facilities for PPE. Today, we are doing the point of distribution deliveries out to the 82 counties, including the Mississippi Band of Choctaw Indians. Just an update on our Business Emergency Operations Center. It was briefed to you very early on that we stood up. We currently have 207 businesses that are registered. These are from all across the country. Most of those are from Mississippi, and we just want to thank again those Mississippi companies that have stepped up, that are assisting us with providing PPE for our great citizens. Disaster update on 12 April Easter tornadoes. We mentioned yesterday we added an additional 6 counties for the IA declaration for a total of 9. As of today, there are 1,751 applications in there for individual assistance. Of that, $1.6 million has already been approved by FEMA for Mississippi citizens to receive housing assistance. An additional $452,000 has already been approved for other needs assistance for those applicants. Those applicants will continue to improve. And as you remember, we opened up 6 disaster assistance centers in the 6 counties we talked about yesterday. There was a soft opening this morning at 8 o'clock. And then they are open, we're fully open for operations at noon today. The hours of operations in those centers will be from 8 to 5 p.m. Monday through Friday. They will be open from 8 to 12 p.m. on Saturday, and then they will be closed on Sunday. We're still waiting a word from FEMA for the 25 counties that we requested to be added to the Public Assistance Declaration. We completed the joint damage assessments, are now waiting FEMA to approve those and add those to the Easter's Tornado Declaration. Approximately $33 million in damages thus far in those the 28 counties, and then we have 2 additional counties we'll probably be adding at some point in the future. On the 19 April tornado, damage thresholds do not appear to be going to be met for the IA and PA declaration. We have, however, requested a Small Business Administration declaration for Marion County, and that will also include 5 contiguous counties around, which would be Walthall, Lamar, Jefferson Davis, Lawrence, Pearl River, and then 1 parish in Louisiana, which would be East Carroll, parish that would be available for SBA assistance there. And then for the 22-23 April storms, we had 10 counties we talked about yesterday that met PA declaration. We've got 2 additional counties that we will also be adding to that for a total of 12 counties. And again, we're waiting joint damage assessments to be completed there in those 10, ultimately 12 counties. Finally, just update for hurricane. We may be looking at our first development in about 100 miles northeast of the Bahamas and off of our southeastern coast of the United States. It is expected about a 50 to 60% chance of tropical development over the weekend, so be watching that closely. Again, that could very easily be our first storm system of the year. So just another reminder that hurricane season is upon us a little early this year, and we will continue to keep a close eye on that, Governor.
Thank you, Director Michelle. Just for those of you who may not be as familiar with emergency management lingo, as I probably wasn't months and months and years ago, when the director talks about IA, what he is referring to is individual assistance. So if you are in that county and there's been a major event, then you, if you sign up, can be eligible for direct individual assistance from the federal government. When Director Michelle talks about PA, what he is talking about is public assistance. So if you're a governmental entity, a city, a county, perhaps even another governmental entity in that county, if PA is approved by the federal government, then you can have your expenses reimbursed by the federal government through the Federal Stafford Act. Several things that I would just like to mention. Number one, I was asked yesterday about a mask that I have been wearing, and I was proud of it, and I wanted to come and show it to you. This mask, while it looks very good, it has an outline of the state of Mississippi on it, a heart in the middle, and a strong for Mississippi Strong. And I think it illustrates better than most things that I have seen, that as we fight our way through this virus, that Mississippi is Mississippi Strong. And I can assure you, if and when I can find time to get my hair cut and I can get to an appointment, I will be adhering to the guidelines that I put in place, and this is the mask that I will be wearing, and I surely hope that happens sooner rather than later. In addition to that, one of the things throughout this horrific event that I have taken great pleasure in was the opportunity to wish so many people across our state a happy birthday. As we are communicating with our team and hearing from so many seniors throughout the state of Mississippi, and knowing that my own daughter graduated from the 9th grade, from junior high into senior high here earlier today, I want you to know that we are looking at an opportunity perhaps to utilize our social media presence to do some sort of graduation ceremony. And so please pay attention to our social media over the next 24 to 48 hours as we tell you when we're going to do that, and also maybe give you an opportunity to shoot us a message eventually so that we can call out as many names from the class of 2020 as is possible. And maybe even you can tell me if you're the valedictorian or salutatorian or some great award or honor that you've received, because one thing we know for sure is the class of 2020 didn't get exactly everything that they anticipated in their senior year. But what you've heard me say repeatedly from this podium is this: sometimes life gives you lemons. You can choose to whine about it, or you can choose to make lemonade out of it. And what I know that these exceptionally talented young people are going to do is they're going to make lemonade out of a difficult situation, and they're going to be better for it for the rest of their life, and they're going to make Mississippi better because of it. So with that, I will turn it over to questions. Courtney Ann?
You've got 7 in this new executive order, 7 counties. I know that we've talked a lot about sets of 12, both for the highest number of cases and for the highest number of cases per capita. Why these 7? Are these the 7 that have consistently been a part of the top 12, or what's the logic behind 7?
I'm going to let Dr. Dobbs answer this as well, but generally speaking, when you look at the total number of cases and you look at the 12 counties in question, some of those counties are more explainable based upon population. And so when you look at these 7 counties, not only are they clustered together, not only are they in regions that have, say, for instance, a significant number of meat processing facilities, a significant number of long-term care facilities, but also just their per capita numbers are so much larger than virtually anywhere else in the state. And so with that, Dr. Dobbs.
Exactly. Each of the counties has a unique characteristic that we looked at closely. Some of the smaller counties that had a high number, like a high per capita, it was related to maybe like 1 or 2 confined outbreaks. So it's not it doesn't go into the general community. And that's one of the reasons from that other metric we were using as far as like the per capita that we're addressing in a different manner. The other thing about these communities is there tends to be a lot of people working in one location and living in another. They seem to be very well integrated and knitted together in a way that it made a lot of sense to let them work together. A lot of this information we got from our site visits of the different counties. And so there's a cohesiveness between them, but also too, if you look at the sheer number of cases compared to their population, it really is, it's a powerful indicator of additional work needing to be done.
The other thing that I would say is also, and I give Dr. Dobbs tremendous amount of credit for this, these 7 counties that are outlined here, this will not come as a surprise to the leadership in these counties. Dr. Dobbs and his team have been doing a fantastic job communicating with the local leaders. Obviously, we've been communicating to each of you in the press and to the people directly to the people of the state. But Dr. Dobbs, I know, has been in at least 3 or 4 of these counties in the last 5 or 6 days, talking to their local leaders. In many instances, the leaders asked for help, asked us to do everything we could to help in this regard. It gives me no great pleasure in having to do it, but I do believe, given the numbers, it's the right thing to do at the right time.
And I would like to add that we're going to be supplying community masks to these locations as well so that we can support people who don't have access or finances to purchase them.
Yeah.
Governor, you chose to reopen the state's economy without following the White House guidelines. And today, Dr. Anthony Fauci said in Senate testimony that states that choose to do that run the risk of creating needless suffering and death by reopening without following those White House guidelines. What is your response to that?
Well, there's obviously intrinsic risk in every decision that I have made in the last 6 months. What I will tell you is that I listened to the advice of our public health experts. We had conversations with Dr. Birx, the coronavirus task force leader, and there is a recognition that every state is different. Every state's curve is different. If you look at the state of New York, for instance, the state of New York had a very, very early peak, which was probably 20 or 25 days ago. And so they have actually find themselves in a position now in which they've probably had 14 days of declines in total number of cases. But they also had over the weekend in any one day approximately the same number of deaths as the state of Mississippi has had throughout this entire event. And so what we have been able to do is we've been successful in Mississippi thus far at keeping it from being a major spike in total number of cases. We've had a relative plateau over the last 30 to 35 days. And so there's I believe, an understanding with most of the individual members on the task force that many of those rules simply do not apply to states like Mississippi, who have been successful at accomplishing our goal of minimizing the significant spike in our state. The other thing that I will tell you is that as you look at our total number of cases, our total number of deaths, you look at our total percentage of deaths over the last 2 weeks that have occurred in long-term care facilities, what we find is we believe we as a state would be much better served focusing our efforts and our resources while still doing contact tracing statewide, but really focusing resources in these 7 counties where the incident rates are going up, and also focusing our resources to the extent possible on the long-term care facilities where it seems to be significantly more damaging than others.
Does it make sense to be opening businesses in those 7 counties where you're seeing these hot spots?
We certainly believe that under the additional guidelines that we are putting into effect today, that we can both protect the lives of the people within that communities if they would adhere to the guidelines, while at the same time protecting the livelihoods of the small businesses in those communities. Renee?
Dave Elliott with WOX has a question. Dave?
Thanks so much, Renee. Governor, casinos and video poker parlors in Louisiana will now open this Monday, May 18th, with pretty strict rules in place. That ordered by Democratic Governor John Bel Edwards. Louisiana has 3 times as many cases as Mississippi, 4 times as many deaths. You talked about a Memorial Day opening. The industry says it's ready here. 2 questions for you. Were you surprised Governor Bel Edwards pulled the trigger? And how much pressure is there on you to now reopen casinos maybe even sooner than Memorial Day, perhaps even next week?
Well, the first thing I would say is I was not surprised at anything Governor John Bel Edwards did because I didn't even know he did it. I'm more focused on what's going on in Mississippi than I am what's going on in Louisiana. And to answer your second question, there is no additional pressure on me to do anything based upon what some governor of another state did. He is looking at his data, I am sure, and making decisions based upon what he believes is in the best interest of his people. What we are going to do in Mississippi is we are going to continue to monitor our data. We're going to get the input from our public health experts, and then we're going to make a decision. But as I have said for the last 3 or 4 days, we are very near finalizing guidelines for our casino industry so that they can get back open. We have always focused on Memorial Day weekend as a time for them to do so in a safe, responsible way. It's not going to look exactly like it looked several months ago when the Gaming Commission shut down our casinos, but I do believe that you will see an announcement from us sooner rather than later that does in fact allow those businesses to reopen.
Mary Perez with Sun Herald has a question. Mary?
Hello, sir. You had also talked about summer camps, and you thought that they would be able to go on as they have in the past. Do you still believe that?
I'm hopeful that they will. I actually have seen a recommendation from the National Council on Summer Camps that puts guidelines in place. If you think about it, many summer camps have some advantages that other businesses don't have. For instance, many summer camps around the country have the ability to, or the way in which they use their labor force is it tends to be college kids. Well, college kids that could go in to these summer camps aren't currently physically at school. Most of them are done with school, and so you could literally take their entire labor force and quarantine them for 14 days before any of the kids actually showed up. And so that would certainly be advantageous to minimizing the virus. And so we're going to continue to talk to our public health experts as to what that may look like, and hopefully we can provide some guidelines as it relates to that. We haven't personally shut down summer camps at this point, just like I haven't personally closed casinos in Mississippi, as I have said repeatedly. The Gaming Commission chose to do that with certainly my support. And so we're looking to continue to find ways to get life back to as close to normal as we possibly can for Mississippians. But we know that as we move into the summer months, short of the heat actually destroying this coronavirus, which has been true in many coronaviruses of the past, but we don't know if that's going to be true with this one or not. But short of that happening, our new normal, if you will, is not going to be exactly like it was in January and February. Yes, sir.
Dr. Dobbs, are you investigating any new illnesses that are resulting in pediatric patients that may be linked to COVID-19? If so, how many?
Certainly we're aware of some of these, strange manifestations, and we've had clinicians report petechial rash and other sort of, inflammatory manifestations like we've seen. We're not doing any specific investigations ourselves, but we're monitoring the clinical situation with our docs, and we have regular communications with all the majority or a large proportion of the docs in Mississippi, so we're keeping an eye on things.
Renee?
Hunter Dawkins with the Gazebo Gazette has a question. Hunter?
Thank you, Renee. Thank you, Governor Reeves. It's somewhat of a hypothetical question in the fact of, I know that you guys have received quite a great fund from the federal government with the CARES Act. Is there going to be any division for that money? Is there a look to utilize any of the BP settlement funds to kind of differ that amount of money that's given in?
Well, thanks, Hunter. I appreciate the question. I personally have no intention of any of the BP funds going to be spent based upon the COVID-19 event.
Emily with AP has a question. Emily?
Hi, Governor. I wanted to ask you about the poultry plants. You've been very reluctant to criticize or say anything about the role of the close conditions the poultry plant employees work in as possible spread of COVID. The counties that you're putting the extra restrictions on today, one thing they have in common is a strong presence of poultry processing jobs. What role do those working conditions in those plants play in the spread of this virus, and what steps is the state going to take to try to help those people over there?
Thank you, Emily, for that question. Again, I'll let Dr. Dobbs answer this as well, but it has been my experience in the conversations that we have had for a number of days, perhaps a number of weeks, with the coronavirus task force nationally. Obviously, meat packing facilities around the country have been dealing with some of the same issues that we are now dealing with. What it seems to be the case is that the spread that occurs amongst the employees of these various facilities, while there, I am sure, is some spread inside the plant, the vast majority of the spread, it appears, is actually occurring in what is considered communal living quarters, where a large number of individuals live in very close quarters, not unlike what we saw in New York City when they issued their shelter-in-place order, where you had a lot of people living in very small apartments, very close to one another. It seems that the virus is more likely to spread in that setting. In addition to that, many of these facilities do run vans from these living places, the places that these employees live, back and forth to the plant. And many of these vans have large numbers of employees inside them. And so, again, I don't know that we have significant evidence that there's been significant transmission inside the plants. I haven't heard Dr. Dobbs say that to date. That could have changed in the last 24 hours, and I'll certainly let him speak to that. And if it has changed, then he'll tell you. But the things that we're going to do in those 7 counties that we believe will ensure that we are protecting those individuals is we're going to have each employee screened at the beginning of their shift. We have a list of 5 questions that each employee should be asked. And again, some of these are already doing some of these things. Some of them are doing all of them. Some of them have more cases than others. But in addition to that, we are going to require that employees that have any symptoms of COVID-19, that they report those symptoms to their supervisor, and that any employee who exhibits any symptoms of COVID-19 during their shift shall be sent home immediately and advised to consult with a physician. We're going to make sure that they have appropriate PPE to be worn by all employees based on their duties and responsibilities and in adherence to state and local regulations and guidelines. And we're going to ensure that their hand sanitizer shall be provided to all employees. Again, good, safe hand hygiene and ensuring that individuals stay 6 feet apart, and if you can't stay 6 feet apart, that you have a proper mask on while you're performing your responsibilities. Dr. Dobbs, want to add to that?
Yeah, thank you, Governor. So there's lots to consider in this question. One of the key components of it is that the individuals working in poultry processing never quit working, right? So they were out there making sure we had adequate food supply. So first thing I'd say is thanks to folks who were out there making sure that we could maintain our food supply. But so they were always working, right? So they didn't have that same opportunity to shelter in place like a lot of us did, or even teleworking. Early on, I know even early March, well before we had our first case in Mississippi, Sanderson Farms executives called me and we talked about ways to prevent it. So by and large, I think they've been very proactive. But kind of speaking to where we are now, if you look at the counties we're talking about especially, and then some other counties, even though there is a significant number of individuals who work in chicken and poultry industry, the majority of the cases in those counties do not work in poultry industry. When we've done our site investigations, we have been doing site investigations and have been well received. We see the processes that seem to be the screening processes and the separations that are being instituted, the PPE requirements, the communications, and that sort of thing. So by and large, we're probably in a good place right now as far as those standards. But it doesn't mean that there hasn't been some degree of transmission within any specific location, like any business. But clearly, it's now amplified within these communities if you look at the numbers of people involved. So we'll continue to be proactive working with the poultry industry, making sure that we can ensure best practice as far as like infection control, supporting the surrounding community, and then also too offering testing where appropriate in those areas or in the industry. So we're going to engage aggressively and collaboratively with those folks.
Thank you.
Alyssa with Clarion Ledger has a question. Alyssa? Alyssa? Dave Elliott.
Hi. My question is leading to higher rates of infection. It appears that chicken processing plants are part of the picture. What else is happening in these 7 counties?
Yeah, so other things that we've seen, if we look at the demographic breakdown, it's still like the rest of the state. It's majority African American. Some of the counties have a higher proportion of Hispanic individuals who are affected. We do feel like that additional work with communications, not only for safety reasons, but also too for testing and access to care, are going to be very important in the Hispanic community, and so we're going to invest considerable effort into that as well. Anecdotally, there's concerns about lack of appropriate social distancing in public spaces, just talking to leaders in the area. And that's one of the reasons why we think some of these measures will be helpful in trying to sort of diminish that ongoing transmission as we do these other natural public health efforts to kind of rein it in.
Renee?
Yep, Dave Elliott with WLX has another question.
Good.
Around coronavirus aid legislation today with a $3 trillion price tag. It includes $1 trillion for states, $375 billion for smaller suburban and rural municipalities, basically left out of earlier rounds. Do you see that as good news for Mississippi, even though it might be hard to square as a fiscal conservative?
Dave, thanks for the question, and obviously for the last approximately 60 days of my life, I have spent most every hour focused on coronavirus response. The fact of the matter is the federal government has spent $4 trillion on coronavirus already in the first 4 packages that they have passed. The reality is that somebody eventually is going to have to pay back all of this money. This is not money that's just falling out of the sky. This is money that our kids and our grandkids are going to be asked to pay for the next 100 years. And so while I certainly appreciate the Congress and the President and the actions that they have taken, I think that what you've seen from the Democrats in Washington is they are more interested in playing politics in a presidential election year where they can go out and promise everyone everything under the sun, and I just don't think that makes very good public health sense. I don't think it makes very good economic sense, and quite frankly, I don't think it makes very good political sense. We are going to focus on utilizing the money and the resources that the Congress has given us already in the most appropriate way possible to help our people, but we cannot continue to run up the credit card just because that's what the Speaker Pelosi wants to do.
So you'll turn away any federal money from the new stimulus package?
We're going to wait and see what the federal government does, and then I'll let you know as soon as I actually see the words on the page. Any other questions?
Governor, how soon will you, working with the legislature, start distributing the $1.25 billion that we already have?
Not soon enough. I'm ready to start distributing these funds. I think it's very important that we get this money into the pockets of the individuals who need it. And so the legislative leadership has assured me that they would move very quickly on these funds, and I'm hopeful that they will in fact do so.
And with this new agreement between you and the legislature, will that preclude hiring that third-party individual that you initially wanted to hire?
I think it's very important that we have pre-auditing of these funds. That is what's going to protect us on the back end. There is no question that you're going to see the Inspector General of the United States Treasury is going to claw back and de-obligate. Mississippians understand what de-obligate means better than most folks around the country, because when we went through Hurricane Katrina, we've got de-obligations in public spending for cities that have spent money in ways that should not have been spent, for other programs. But in the program that was run to help homeowners, there was very, very, very few de-obligations because there was pre-clearance and pre-auditing of the funds, and I think that's critically important. We're continuing to have conversations with legislative leaders, had conversations with them as recently as yesterday. We are working together right now to make this happen, and I'm hopeful that we can find a resolution that benefits the people of our state. That is what I am focused on. That's all I care about, is how often and how quickly can we get money into the hands of the people who need it. That is my goal, and I trust that they share that goal.
Can't the state auditor's office handle that pre-clearance?
No, they cannot. You cannot have someone. They can handle the pre-clearance, but then they can't audit the funds on the back end. So the way in which this is going to work, in my opinion, is that the auditor needs to maintain their independence on the front end, so that on the back end they can come in and audit those funds so that they can find any wrongdoing that may or may not have occurred. For instance, we recently had a scandal at the Department of Human Services before I was elected. The state auditor, who has done an annual audit of the Department of Human Services, has recently completed a single audit in which obviously they have made multiple arrests. Not only have they made multiple arrests, they have also identified a certain pot of money that may or may not have proper documentation as to how it was spent and if it was spent within accordance and within the guidelines of HHS. And what I would tell you is, if they had not maintained their independence on the front end, they could not have done that investigation on the back end. I've been in state government for a long time. I can't tell you how many times when I was treasurer, I reached out to the state auditor and said, hey, this is one of the things that we are thinking about doing. We want to make sure it's okay, because we certainly don't want to go down a path that we shouldn't go down. They repeatedly told me, as they repeatedly tell state agencies all the time, if they are going to produce the CAFR, if they are going to produce the year-end audit, then they cannot provide advice on the front end and maintain their independence that things were actually done right and according to accounting standards on the back end. Seeing nothing else, thank you to everyone. Continue to wear your mask in public, and God bless.